Two sets of people, living 250 miles apart, are now forever connected. A simple conversation at work sparked a life-changing decision.
And he opened up to me about his kidney failure and that he was sick, and I asked him what I could do to help.
Meet Svetlana and Jorge, co-workers at an equipment rental shop in North Texas. One with a desperate need for a kidney transplant, the other with the courage to help. But after applying to be a donor, Svetlana was told she wasn't a match for Jorge.
A little while after that, UT Southwestern had called me and they said, well, I remember telling you that you couldn't donate to Jorge, but we could do a swap with somebody else.
Ann Weiner, a San Antonio resident bound to a life on dialysis, also found herself desperately looking for a new kidney.
I ended up with these weird antibodies that were really hard to match for this.
Doctors said only 6% of the population would be compatible as a donor for Ann's case. Her daughter, Rebecca, similar to Svetlana, who was eager to help, wasn't a match for her mom.
So I'm doing a paired donation for my mother.
But had agreed to a paired kidney exchange.
I will donate to someone, and they have someone who's not a match who will donate back to her.
UT Southwestern Solid Organ Transplant Program in Dallas and University Health Transplant Institute in San Antonio searched beyond their own institutional networks to identify suitable living kidney donors for their failing patients.
Nearly 6,000 living donor transplants happened last year. But there is a segment of that population in need of a transplant that are more difficult to match, whether it's immunologically driven or anatomically driven. Hence, the pool of our collective resources as teams helps to provide that access for these uniquely challenging patients in terms of matching.
It's a joy to have another institution that's willing to say, sure, let's do this. Why wouldn't we do it? Why wouldn't we do it? And get those patients off the waiting list and get them back to living their normal lives.
Both institutions' HLA laboratory teams jointly worked their magic to find the right living donor. Together, they successfully identified genetic traits that made Rebecca a good match for Jorge and Svetlana a perfect match for Ann.
There are various ways you can do the swaps and various reasons to do it. I still think it's just one of those situations where it never gets old.
Great. We're going to do a kidney transplant, living donor to the right side with PT catheter removal.
Dr. Parsia Vagafi says only a quarter of transplants performed at UT Southwestern are from living donors. But he's hoping to build that part of the program as living kidney donations last longer for the recipient.
It's really great to participate in it and really form that collaboration with others that are working towards the same mission but in a different city, and really be able to cross those geographic boundaries and really help two different families out.
And getting the chance to uniquely partner with another institution is a direction he wants to continue.
Then we began discussing just, when would we start the surgeries? How would we transport the organs? How would the organs be tracked?
The transplant teams spent weeks carefully choreographing surgical schedules and chartered flights to ensure the swap happened seamlessly.
In this case, it could be tracked minute by minute in the plane via a tag that was on the box that was used to transport them. It is important because we want to keep the time that the organ is out of the body without blood to a minimum.
That one's been well checked.
On the day of surgery, spirits were high.
Hopefully, I'm going to start feeling better. I'm going to have a granddaughter in January, so, I get a chance to see her and live a little bit longer to spend some time with her. Thank you very much, and I owe you the world.
And written words were exchanged.
It says, "Dear donor, thank you for giving me back my life. I thought I would never get a transplant with my weird antibodies, and then you came along. Bless you, Ann."
Hours after the transplants, both sets of people doing remarkably well were able to reunite.
At the end of the day, I'm happy that we were able to find these two people that were going to be really hard to find kidneys for. So it's kind of, I feel like I've been able to help two people and not just one.
I don't think of it as me saving somebody's life. I think of it as me giving Jorge's family members more time with him. I hope my recipient just, whatever she hasn't accomplished in life yet that she ultimately wanted to do, I hope she gets to do it. Life's too short to not live out your wildest dreams.